morning, everyone. This is Elizabeth. We're going to get started in just a couple of minutes. Becky Horn is on, so we've got everything ready to go. Um, while you are sitting there waiting for this to start, go ahead and check out the chat box. We have a question about purchasing NRT. So if you have any thoughts, go ahead and let us know. And like I said, we'll get started in just a few minutes. Good morning, everyone. This is Elizabeth Anderson Hoagland with the Tobacco Prevention and Cessation Program. Thank you for joining us this morning. Um, I'm just going to warn you that we're still using GoToWebinar, but previously they've had me go up to to a different room where they had a special setup, and they have given me control of my own GoToWebinar system. So I'm now calling in from my desk and my computer. So everything seems to be running smoothly so far, but if you've noticed any differences this month or anything that's not working as well as usual, please send me an email or a question or a note in the chat function, and I'll make sure that I get any technical difficulties taken care of in time for November. Something else I would like to draw your attention to, we have a question from Cindy Steele with the Bourbon County Health Department. She has been purchasing nicotine replacement therapy using ASAP funds, and her supplier has recently been purchased by another supplier, and the price has almost doubled for their nicotine replacement therapy patches. So if you are a health department or someone else who purchases NRT, if you wouldn't mind either answering Cindy's question or typing something into the chat box about who your supplier is and what your purchase price is, I will go over those at the end of the presentation. So with that, I will go ahead and turn this over. Today we're hearing from Becky Horn from the Green River District Health Department. If you have been looking at the maps about quitline calls across the state, we have a couple of areas that are real standouts in terms of referrals, and Green River District is one of those. So we're inviting Becky to talk about what they do to promote the quitline in their area, how they pay for it, what they actually do with it, and oh, Jenny says she's having a hard time hearing me. I'm kind of a quiet speaker, and I've got this. I use the earpiece, and I don't know that it always picks me up very well. So thank you for that, Jenny. What I was going to say is that the Green River Health Department and Becky, they do a great job of promoting the quitline. So we thought we'd give her an opportunity to come and just share what she has done to see if there's anything that you all can replicate in your own communities. So with that, I'm going to turn it over to Becky.
Hello, everybody. If there are technical difficulties, it probably could also be on my end. I was telling Elizabeth, my computer is from the Stone Age, and I'm so due for a new computer, but it hasn't quite shown up yet. So hopefully this will cooperate, and we'll be fine. I'm going to talk to you a little bit about some of the things we've done, and really it's just some of it was out of desperation. You know, we were not getting a lot of calls to the quitline, and we also weren't getting a lot of people showing up for Cooper Clayton, and that's when this came back up. I know a lot of people don't do Cooper Clayton, and we've also switched over mostly to freedom from smoking, but at the time it was Cooper Clayton when we kind of started to brainstorm this. So, you know, when I started several years ago, many years ago, I think 15 years ago, we would get, especially in January, maybe 50 or 60 in a class, and, you know, it was getting to the point where it'd be, you know, either Rich or myself or one of our partners, you know, in a class with two other people. So we just kind of sat around and brainstormed and how can we use the quitline to a little bit more of our advantage, because, you know, that was in, you know, Owensboro. The classes were usually in Owensboro and Henderson, and a lot of the rest of our counties are pretty rural, and the classes just aren't as convenient to get to in a very rural county. So we felt like we weren't serving them as well as we could have anyway. So that's where some of this had kind of brainstormed from. We're very lucky. Our Owensboro Health, our local hospital that serves all of our 7 counties plus a couple, offer a yearly community benefit grant. And so we decided several years ago to utilize that. We wrote for the grant, and it was more for quitline promotion, because, you know, we all saw that statistic, and I can't recall at the top of my head, I think I might have it on the slide, where, you know, only 25% of people, or maybe even 12% of people, knew there was even a quitline in our state. So we thought, well, you know, as much money as people spend on advertising, you know, tobacco products and things like that, we probably need to spend a little bit of money trying to get the quitline out. So that's the first few grants were kind of geared more toward that. When Owensboro Health does their grant applications, they have really partnered with us and done well in helping the Green River District Health Department out, because they are following along with our community health assessment and then our community health improvement plan, which those of you that have been through the accreditation process are very well familiar. So, you know, the last few years in the accreditation process and leading up to accreditation, we did a lot of community assessments, forums, surveys. We even did the door-to-door knocking on the doors. And so all proposals must address what we had discovered were the top 3 issues in our community. And so that was a kind of a real boom to us as far as, you know, helping us along in our goals and objectives. Also, they required partnership with our local health councils. We have health councils in all 7 of our counties. That's part of our, you know, helps us with our accreditation and improvement plan. So, you know, partnership with those health councils is required. Collaboration, and of course using evidence-based practices, which that's pretty much always in a grant proposal. You usually have to use some type of evidence, especially if you're doing a curriculum or you have to prove that it's going to be effective. Our identified health needs, they've changed a little bit the last time we did it, which is in the fall, and we're still putting that data together. So the last few years, our identified needs were access to care, substance abuse, tobacco use. Some counties actually stated tobacco use, period, and then obesity. So all grant proposals had to address one of these three issues. I'm not going to read all this to you, but this is part of our grant proposal. This was part of what went into the grant. We said that our grant proposal, by utilizing the quitline, by promoting the quitline, that would address an access to care issue, because not everybody can go to a class. Not everybody can make it, at 5 o'clock on Tuesday or whatever time your class would be. So we're eliminating that barrier of access to care, and also reducing substance abuse, tobacco use, because it, as the rest of you, our rates of tobacco are just as high or higher than the rest of the world and the rest of the nation, maybe not the world, but the nation. So those were the two identified health needs that we could cite in our grant. That's our goal. That was the first goal we had, was to increase calls and utilization of the quitline. Our action plan for the first set of grants was we wanted a multidimensional marketing campaign. We used newspaper, online ads. We wrapped a grits bus, which I'll have a picture of here in a little bit. The first round of grants, we did some billboards, a lot of radio, and the health department has a monthly segment on one of our local news stations, so we utilized some of the free things we had, newspaper articles. We worked with the health councils. Usually our local health councils are made of, local hospitals, healthcare providers, extension, school personnel, just members of the community that are interested in health and related. The MCOs are usually there, so we made sure they all had all of our information on the quitline, and when they went out to health fairs and community events, they also took our stuff with them. Kentucky Cancer Program does the Plan to Be Tobacco Free, and she was doing a lot of that at the time, and she would always promote our quitline with that, and that's part of their plan anyway. And then we also have a CAP program, which our CAP program, people who are underinsured or uninsured are linked to physicians, pharmaceutical companies, things like that, to get care at a low or no cost. So, and that's high rate of smokers in that program, so we also utilize that program. Our measurable objectives were to increase the calls to the quitline. Oh, yeah, that's the stat. 75% of Kentuckians that are trying to quit smoking, only 29.7% are aware of quitline services. So those are the ones we felt that we could measure and control. And thankfully at the time, Bobby and the Quitline National Jewish were very good about getting us the numbers, so we could see if we're doing what we were supposed to and what we said we would do. There's our bus. I know Bobby had retired, but she just loved that bus. When we sent her a picture of it, she was so happy. But we keep that bus wrapped. It was about $6,000 to wrap it years ago, but it's only $1,000 or so to keep it wrapped. So that bus drives around our 7 counties. The Grits Audubon area Grit Services is transportation for those that need transportation to medical appointments, doctor's appointments, various services in our community. So it's a good advertisement, and then anymore it's cheaper. That's one of our online ads. I think that was with our Surf Kentucky News, which are some online newspapers in the area. Just a different version. That's one of our billboards that we put up. We didn't do billboards the last couple of times, but the first couple of rounds of grants we did. that's just a little bit more on our DC CAP program. It's to increase access to health care for the uninsured and underinsured. Um, they are assigned donated medical services, and we partnered with them just because of the high rate of smoking in that clinic. It's housed in our health department, and they see a very high rate of smoking in that clinic. So we put together actually packets of information for them that included our quitline, but we also had some information on eating and stress management and things like that. So they were called our quit packets. We also trained staff, not just DC CAP staff, but our clinic staff on the 5A's. We made sure that they realized, the 3 to 5 minute protocol and how to properly train, and making sure that they realized how to help clients set their quit dates and overcome their roadblocks. So we have a training on that, a PowerPoint training that we have to bring out every once in a while as we get new staff. But that's been something really helpful. I always feel like that when I go out and, say, you need to quit smoking, it doesn't have quite the same effect as maybe one of our nurses or, our physicians do. So we always try to keep them up to date on the 5A's. I think I already talked about that, how they were given a packet of information. We also included e-cigarette information, too. That seems to be the big thing now. I'm sure a lot of you all are experiencing that. So we've got some information on e-cigs in there, and how, the quitline is really the proven way to stop smoking, not e-cigs. Our next steps through this next grant, and I'll talk a little bit more about that in a minute, the current grant. But this time we have hospital liaisons, and we've got some good hospital representation on our coalition. And that's kind of the gap we had in the previous years, making sure those physicians, the office managers, the nurses are promoting the quitline also. The different doctors and hospitals, I know we're promoting in our clinic, but it needs to be promoted in all clinics. So we need to make sure the hospitals, doctors are aware that the quitline is out there. Let's see. I'm going to go into another slide, another slideshow to show you a little bit more about our current grant. Our current grant, as I'm doing this, our current grant is let's see. It deals more with the if my computer works, I'm sorry. Our current grant's dealing more with the access to care in terms of our medication. We need to be able to provide. We found the barrier to care was with the medication. We wanted to be able to provide our clients and our community members with the free NRT. And I really am going to have to give a shout out to our Northern Kentucky partners. This is something that we kind of stole from them. We wanted to provide the free NRT, and we had heard about it at a meeting, and we asked them what had happened and or how they did it. And it was through the National Jewish, and we thought, well, how easy is that? Years and years ago, we had NRT on site, and it really didn't go that well because it would expire. We couldn't, we didn't have what people needed. We were wasting a little bit of money, and we wanted to make sure that we could do it the proper way. So when we found out about the Northern Kentucky Health Department providing it through the quitline, we thought this would be the way to go. So the last 2 years, we had done free NRT through the National Jewish. And setting up the National Jewish has been a really, really easy. They're very easy to work with. They provide contact or a contract for us. We submit that with our grant. They've been able to keep up with the calls and all of the information. And that's been very helpful in receiving the grant more than once, so that we can actually find the proper data and information that we need from the quitline numbers. I know Bobby provided it for us, but the National Jewish will also provide, when you contract with them to provide NRT, they will provide you with a number of patients receiving the NRT. Was it their first 4 weeks? Was it their second 4 weeks? Did they get lozenges? Did they get gum? Did they get the patches? So I think I'm going to have to go into my email and get this. But what did they actually get, and how much of it? And we actually gave them a limit. We had, I think, $17,000, and we said, we can't spend over that. And once it was done, it was done. That $17,000 lasted until about April. It was September through April, and we had that. Let me get this open. I've got it now. And we provided 218 people in Green River with free NRT. So Owensboro Health was pretty impressed with that. Was impressed with those numbers, and they wanted to make sure that we could do it again this year. So that this is the second year of being able to provide the free NRT. We also wrote the grant for, we'll call it Elizabeth's grant. We also wrote Elizabeth's grant, and we used that grant this time to do the promotion. In the past, it was a hospital grant doing the promotion, but since we switched the hospital promotion to, or to the hospital grant to just purchasing pretty much the NRT, we still needed to get the word out there. So we needed to make sure that we had some advertising money. So we wrote the grant to the Kentucky Department of Public Health for our online ads, our radio, our newspaper. Oh, my computer's so slow. I apologize for this computer. Does anybody have any questions while I'm waiting for this? I just wanted to show you all a couple of the ads that we used. Anybody have any questions while I'm pulling this up?
Let's see. I think everyone on the phone is in mute.
Okay.
So if you have questions, you can type them into the question box, or you can type them into the chat box. And as a reminder, if you do purchase NRT, please let us know your supplier and your purchase price so we can pass that on to Bourbon County. And I understand my computer was super slow before they replaced it.
It's thinking about it.
And when Becky says Elizabeth grant, that's the local grant, which those come out every year. So if it's not something you've written before, you can always contact us at the state office, and we'd be happy to talk about it, talk about your ideas. If you've never written a grant before, we're happy to pass along some resources helping you write grants.
Oh, I'm so sad about I guess I'm going to have to go up to IT at some point and tell them I really need a new computer. What I'm trying to do is show you guys some of the ads that we use. And I'll just tell you right now, what we used mostly the CDC ads, the free ones, the different ones that we use, the ones we're using for the TV right now. And we just kind of modified them. They allow you to put your logo on there. We put a little blurb in there about the free NRT. And we really, and we've used those. We don't use newspaper as much anymore because our newspaper subscriptions are down. But we did use some of the local county newspapers. I don't know if any of you guys have those small county papers that come out once a week. Those are still pretty highly used. And we did use that probably a couple times, not a whole lot. We also have Owensboro Family and Owensboro, it's called Owensboro Family and the Henderson Family magazines. They're local magazines that are pretty much doled out to doctors' offices, hospitals. We did use some print ads there. So we did use some of the CDC tips ads, the e-cig ones. Let me try it one more time. Let's see if it'll come. and we also used some radio ads, and the radio ads we just kind of gave them the brochure and let them know what was out there. Oh, here they are! Yay, they came up. Um, I just want to show you guys a couple things. The Owensboro Health Action Plan, if you want to use that, or Elizabeth could send this all out to everybody. We offered 8 weeks of free nicotine patches. If you're wondering how long, they would have to call and get the first 4 weeks, and then they would get, if they kept up with their calls, they would get the second 4 weeks. You don't have to do anything medically or do any type of screening. National Jewish takes care of everything, and they would get the reports pretty quickly. And that's some of our promotion, the online ads, the different, the Surf Kentucky News, the county papers, Grits Transportation, and I've showed you that. These are some more of our online ads, and these are a little nicer than the last ones. These are from the Surf Kentucky News, and this is advertising our free nicotine replacement. And we stated which counties you had to be in. These are our quitline ads. That's from the TIPS campaign. We ran that one just recently, and you can see we put how the free NRT. We put our logo on it. That was February for Heart Month. We did use their e-cig ad and we also put that in some of our local football programs, because of course, as many of you know, the e-cigarettes and the kids are a huge problem. So we did use the e-cig ad. That one is particularly, we used that during November, which is also the Great American Smoking Out, but also Diabetes Awareness Month, and that one is always particularly kind of dear to my heart because my father suffered from the same thing. So, our diabetes educators right down the hallway from me, so we teamed up together for that ad. And you can also see, please call for your free NRT. That was in our Owensboro Family Magazine that I was telling you about for a reduced price. If we had provided an article, they would also give us an ad. So we wrote a little article explaining what we're doing. Those are our numbers. This is the number, and it didn't copy and paste very well, that from the first grant, hospital grant, where we provided NRT, or before we didn't provide NRT, that was 237 for the year. Last year, it went up to 324 calls to the quit line. So it's a big jump. I think the numbers in 2015 were 142. And there was one year, I think it might have been 2013 or 14, before we started promoting the quit line at all. I think we had 3 calls total to the quit line. So when you give them that numbers and talk about the percentage increase when you're writing a grant to the hospital, they were pretty impressed that we went up that much. And we're hoping the 324 goes up quite a bit this year because we did not have to pay any setup fee and things like that to National Jewish this year. So we have a lot more money just to pay NRT. So we're hoping, I hope we run out in April again, but I hope we run out serving a lot more people. So for the months of May, June, July, and August, we didn't have any money to provide NRT, but I would rather do that than be sitting here with a couple thousand, not being utilized. So we're glad to run out of money. Okay, and there you are. Sorry for the computer problems.
Thank you so much, Becky. Let's see. The one question I got was, if you were with the health department and you were interested in setting up a contract with National Jewish Hospital to provide nicotine replacement therapy, just go ahead and let those of us at the state office know, and we can put you in contact with National Jewish Hospital. Our contact is C.L. Fisher, and we have a couple of health departments and a couple of businesses that have contracts from the state. So that's something we can help you navigate and set up if you are interested in doing that.
Now, I did get an email from C.L. yesterday. She's going on a leave of absence, and she sent me another contact. So I might need to forward that up to you guys. She's going to be out for several months.
Yeah. Actually, she's expecting a child. So
Oh,
yeah, felicitations to her.
yeah.
Um, and but yeah, um, if any of y'all want to work with National Jewish, just let us know, and we can help you navigate that. And they are, like Becky said, they're very easy to work with. They like to do this type of thing. Um, let's see. I have not received any answers about nicotine replacement therapy and pricing. I'm sorry, Cindy. But as you think about it, if you have to go look up the numbers or talk to someone, just go ahead and send me an email or send Cindy an email with that information, and we'll be happy to pass that along to people as we find out NRT pricing. Our next call will be, let me look at my calendar. It will be Tuesday, November 6th at 9:30 a.m. Eastern Standard Time, 8:30 Central Standard Time. And um, wait a minute, never mind. It is actually going to be November 13th at 9:30 a.m. Eastern Standard Time. It's going to be a non-standard day um, because November 6th is voting day. Everyone, please go out and vote. So I apologize. Let me repeat that. It is going to be, our next call is going to be Tuesday, November 13th. Also happens to be my birthday, just pointing that out. If you had any problems with technical problems, go ahead and send me an email and I'll try to have those worked out by next month. And Becky, thank you very much. This was very informative. They do a great job. If any of you are doing a great job and you want to tell everyone about it, please let me know. I'm happy to let you do that. And with that, I think I'm going to let everybody go. Thank you all so much.